Hey gang, Dr. D's Health Tip of the Week. A lot of women come in when I recommend the 3D digital mammogram. They say, I already got breast thermography, I'm all good to go. And I wanted to make sure women know the difference between mammography and thermography. Thermography, unfortunately, is very topical. You can use thermography for things like looking for an infected tooth, but it does not show deep breast lesions. As an example, I had a woman once get a full body scan with thermography, and they said nothing about the massive inflammation in her coronary arteries. She had a calcium score of over 800. Over 400 means you're going to have a heart attack 50% of the time within the next 6 years. So we couldn't see that calcium inflammation in the heart, and I started getting weary about, is a breast thermogram just as good as a 3D digital mammogram? And the answer is absolutely not. If you want to track with a thermography, nutritional changes, pulling inflammation out of your body, that's great, but you're not looking for early cancer in the thorough way that the 3D digital mammogram is. So one of the questions that come up for me, because we have highly educated patients come into our office, they want to do things smart, they want to be empowered to make good healthcare decisions, and they can be a little leery of the conventional model, maybe because of a bad experience with a prescription, or a doctor missed their diagnosis, etc., and I can appreciate that. But we want to bring back with a resounding bugle, the 3D digital mammogram is an awesome image, and the concerns we've had in the past no longer exist with this new imaging. So historical concerns of mammogram that I get from our female patients are too much radiation. And this is a big problem. Something like a nuclear stress test comes with 40 millisievert, and that is a massive amount of unnecessary radiation, and we should stay away from those nuclear stress tests and go with the EBT heart scan, minimal radiation, high resolution, and that's what we're getting off of a mammogram. A mammogram has 0.7 millisievert of radiation per mammogram. To put that into context, living in Boulder, Colorado at 5280, I'm getting 5.0 millisievert. I'm getting 7 times the radiation of a mammogram just living in Boulder, Colorado per year. OSHA, who sets the standards on what's safe for us, and again, sometimes OSHA wins and sometimes they lose with some of the recommendations, but as a generalization, they say it's cool to get 100 millisievert per every 5 years. That leaves about 20 millisievert per year, and I'm spending 5 of my radiation exposure millisieverts on living at a mile high. Very easy to fit in 0.7 millisievert from a mammogram, so the radiation is no longer a conversation. I think that's misunderstood. There are other images like a virtual colonoscopy that are 5 millisievert that we want to take into account. We also want to say, again, the nuclear stress test, 40 millisievert, that's a lot of radiation for an image that isn't that great. So the mammogram is relatively low radiation, and people need to understand that. There were too many false positives with the old mammogram. That's suggesting we have a breast cancer lesion, and we don't. And we'd get a lot of fine needle biopsies that were unnecessary, a lot of panicking women when there was nothing there, and we wanted to really get past that. We have with the 3D digital mammogram. So with imaging, you want low radiation and high resolution. Resolution is my ability to see that tissue. So the 3D digital mammogram has the exact same radiation, 0.7 millisievert, as the old mammogram, but with profound improvement in resolution. So we can now see much clearer that breast tissue, not scare women with false positives, not do unnecessary needle biopsies, and get the mammogram done. At least an occasional mammogram, 3D digital mammogram, is a good place to start. Maybe you don't need a mammogram every year, and you can take into account your family history and what your doctor's saying about that. But please don't be scared of this wonderful 3D digital mammogram that is in our model of prevention through early detection of breast cancer. If you find it early, the treatments are simple, and you can often avoid radiation and chemo. So stay up to date with your preventative imaging. We start at 40 years old in women with absolutely no symptoms or no family history, and we'll cheat down to 30 to 35 years old, even younger if there's an extreme early breast cancer in that family history. I hope you appreciate Dr. D's Health Tip of the Week. And if you're 40 or older and haven't gotten your 3D digital yet, get to it. And remember, ask them, is your machine a 3D digital mammogram?